hello everyone, and welcome to this month's SME Symposium. I know we aim to do one every month, and I think that some of the timelines been a bit difficult recently because I've had exams, had my finals and stuff, so it's been quite busy. But the aim is to kind of keep it every month, so fingers crossed we'll kind of keep that going. Today's symposium is on becoming foundation competent in the NHS. And we're going to be talking a lot about CREST. And I know when I mention things like CREST, everyone's like, what is CREST? And I am the same. I don't know a lot about it either. So hopefully our guest speaker will kind of go into a lot of detail. Right, okay, so like I mentioned, one webinar every month. So monthly webinars dedicated to keeping you up to date on relevant and important medical topics. Everyone is welcome. So even if you're not an SME student, guys, please do join in. Any medical students, especially international ones, they're really beneficial. The webinars are completely free, so please do join in when you can. And there will be a question answer at the end, and also wait until the end for a few other things like scholarships and free Lecturio sign up as well. I think it's like a 6 months trial or something like that. So I'm really excited about this actually. So today's speaker is Dr. Kaj. That's what I call her, Dr. Kaj. But her name is Dr. Kajenthiny Ganeshamoorthy, and a very, very old and good friend of mine. So we've known each other for a while now, and I love doing these webinars for this reason alone, because I kind of get to catch up with former colleagues. So Dr. Kaj, she is an FY1 at Aberdeen Royal Infirmary in Scotland. So she's gone very far away from all of us. And so she will be talking about CREST, outline of CREST, completing CREST, and career progression. So she will be joining us very soon, guys. Also, certificates will be provided for everyone who's attended. So make sure you wait until the end, guys. I'll explain how that kind of works. Okay, so I always start all the talking. So 6 till about 6:10 p.m. That's when I kind of just do the introductions and welcoming and all that kind of stuff. In a few minutes, I will be passing this on to Dr. Kaj. And then after Kaj is finished, we will do a question and answer, which I will be joining in as well. So any questions I can answer, I will do that. And any questions that you have for Kaj, she will answer those as well. So, alrighty, I will talk about that in a bit.
Hi everyone, and thank you so much, Molly, for that introduction. It's nice to see you and catch up this way as well.
Definitely.
And welcome to the symposium on CREST and becoming competent in the NHS. Apologies for my tired appearance. I'm trying to sandwich the symposium between night shifts, so if I seem a bit dreary and down on my energy, it's not because I'm not passionate about this topic. It's just I'm slightly sleep deprived, so do forgive me. And I think without any right, so as I said, my name is Kaj, or Dr. Kajenthiny Ganeshamoorthy, and I'm currently a clinical fellow FY1 at Aberdeen Royal Infirmary. And this position is similar to that of a foundation FY1, in that I'm able to join in on training opportunities and also complete tasks and complete my portfolio towards becoming competent in the NHS. So let's move on. Right. So Molly mentioned the word CREST, and it dropped a hint as to what the topic is about, but I'm here now to explain what exactly CREST stands for and what is the use of the CREST and a bit more information really about it. So CREST is actually a form that need to be completed, and this form stands for Certificate of Readiness for Specialty Training. Now, essentially, this form is what will prove to upcoming training programs, training deaneries, that you have all the skills, knowledge, and competencies needed to start on a specialty training program. Now, of course, the first important step is having a valid UK medical license, which is only attainable through getting a medical degree and then registering with the GMC. However, for entering a training program, you would also need to show that you have the basic competencies in preparation to be eligible for the training program. And it's one of two routes to enter specialty training, and it is the only route if you're not eligible for the foundation program. So who needs to complete a CREST form? I'm sure amongst you, you could be medical students either in the UK or students studying outside of the UK. You might be recent graduates, either from the UK or from medical schools outside the UK. Whichever stage in your career, in your education you're at, congratulations on coming this far. Now, to understand whether you need the CREST form completed, you need to find out which category do you fall into. So you could either be a medical student of any graduate school, regardless of whether you're from the UK or not, whether you have completed a 5-year degree, in which case you would still require to complete the full foundation program, or whether you've completed a medical degree outside of the UK with the foundation year 1 internship included. So you may fall into different categories. Now, out of the 4 categories, A being all medical school graduates, regardless of type of GMC registration, B being only UK medical school graduates, regardless of type of GMC registration, C being only international medical graduates with full GMC registration, and D being only international medical graduates regardless of type of GMC registration. I would like to take this moment actually to see what you do know about the CREST, and whether you can either you're able to know already or can guess which category of medical students or medical graduates will need the CREST form signed and completed. So if I can take a few moments for you guys to choose the correct answer, or what you think is the correct answer, and then we can explore which one is right. So Molly, can I ask help in demonstrating what the answers are that's coming up, and we'll be able to see how much you understand of the CREST form already? Or
Definitely.
Yeah, thank you so much.
I will participate. I will do my best.
Okay, great.
Can you see the questions? I mean, the answers. Are you able to see them?
I believe not, but I'm not very computer savvy. So if you can just,
all right.
Am I right in saying I can click on the Q&A and
yes,
I'll be able to see the answers? Great. Okay.
Perfect.
So
yeah, just go on the question and answer, and the open ones will have everything on there.
Okay, perfect. So I'm seeing a couple of answers come in already. Some A's, some C's. Let's see. We'll give everyone a couple of minutes, and then I'll be able to go through and see which of you did get it right and which of you were close but not quite there. Honestly, it's not something that you're meant to know already. It's just for me to have an understanding of where people's answers are coming from, and also to highlight, you know, the intricacies of, you know, who is needing the CREST form and who unfortunately or unfortunately may not require it. So this is, there's no competition as such. It's just for me to have an understanding of what today's audience have of the CREST form.
Do I need to give an answer as well?
Yeah.
If I get it wrong, it'd be so embarrassing.
We're all here to learn. Honestly, we're all here to learn. And I believe this time last year, or even this time 6 months ago, I may not have known as much about the CREST form as I know today. So it's a learning process.
Same, I agree. Because the thing is, when we were talking about topics for this month, and you mentioned CREST, straight away I was like, okay, you know what? Even me, as a final year medical student, don't know about this. It would be a really, really informative one.
Yeah.
I think I'm gonna go for A, guys. I'm gonna go on the A team.
Okay, great.
We'll join the A team. Let's see what happens.
Right. Right. So I think we will. I'll review the answer and we'll talk about why people may or may not have thought, you know, either A, B, C, or D were the correct answers. But thank you everyone for participating. Is it A? Well, all medical students, school graduates, regardless of type of GMC registration. Now, what that means is you could be a graduate of a medical student in the UK, a medical student in Europe or outside of Europe. It does not matter where you graduate, and it also does not matter if you have full GMC registration or temporary GMC registration, with the caveat that you need to complete your internship, which is also equivalent to FY1. Now, this may give everyone a clue as to whether they do need to fill in a CREST form or not, because if the GMC registration is only a partial registration or a temporary registration, and graduates fall under the category of needing to complete FY1 to become fully GMC registered, that in itself suggests that you need to complete the UK Foundation programme. And so you are not requiring the CREST form to be completed. So for everyone who guessed A, a good guess and a sound guess, I would say, but unfortunately that's not the right answer. So Molly, good effort, but unfortunately not the right answer. Now, I know, by the same reasoning, only UK medical school graduates who will come out with a temporary GMC registration and needing to complete the foundation programme will not require the CREST form and will not be eligible for the CREST form. So B is not the right answer. We come on to C. So only international medical graduates. So these are graduates who graduate from medical schools outside of the UK with a full GMC registration. So there's no caveat to completing any competencies in the FY1 foundation programme. And they are already GMC registered because their degree includes the FY1 equivalent, which is the internship. These are the very graduates who do need the CREST form completed because they are not eligible to enter the 2-year foundation program. And so those of you guessed C did guess the correct answer. And D was a slight rogue answer I'd put up, in that you're right, international medical graduates often aren't eligible for foundation program because a lot of the medical programs come with their own internship here, and therefore they register as full GMC registration. Now, lately there have been some medical schools whose program does not make the graduates eligible for the full GMC registration, because none of their program is considered having an internship year. Therefore, the small portion of these students will need to go through the foundation program, and therefore D was not the correct answer. So thank you everyone for participating, and well done on those who've guessed it correctly. So IMGs and CREST, from our little QA session, you could have guessed that most CREST form, most participants needing to complete the CREST form are IMGs, otherwise known as International Medical Graduates. And to expand on the reason why IMGs would need to complete the CREST form, it's really to level the playing field and to ensure the training program, the deanery to which you would like to apply for your specialist training, that your skills, your experiences, your knowledge, and your competencies are at the same equivalence of those who've completed the foundation program. And one such way to prove this is to go through the CREST form, which allows senior colleagues, these can be registrars or consultants, to identify the skills that you have that qualify you for entering a training program, and sign off on those competencies, so that for upcoming interviews on your training program, you're able to clarify that you have those same competencies that your fellow colleagues who've completed the foundation program demonstrated too. So this is not a way to discriminate or differentiate those who've graduated in the UK versus anyone outside of the UK. This is just an alternative pathway, very much similar to the foundation program, in order to prove the same competencies and demonstrate the same competencies. And this also gives the trainee, the graduate, a confidence that they have completed skills and knowledge needed to prepare themselves for the training program. So it's a win-win situation in both ways, really. Now, moving on, let's have a look at the form itself. So just for a bit of background information, the CREST form is one that needs to be printed out and completed old school, i.e. you need to fill it in with pen and paper, and essentially this must be filled in based on information and skills picked up in the last 3.5 years of your medical career. So any employment you had in the past 3.5 years, and the competencies that you were able to complete in those 3.5 years are the only ones that were valid to show as evidence for the CREST form. The first part of the CREST form is, of course, your personal details. I don't think I need to expand too much, but of course your name, your GMC number, and here it highlights that you do need full GMC registration to complete the CREST form, and also your job title and the details of such job titles that you're basing your evidence on. Moving on to part 2, we have the personal behaviour and trust section of the CREST form. This is essentially completed by both yourself and your consultant that you've chosen to complete your CREST form with. Now, in this part, you would have demonstrated where you showed professionalism, confidentiality, able to gain consent, both verbally and written consent. able to show patient-centered care where you've given different avenues of management, and patients were able to choose an appropriate management plan according to their own health needs, but also social situation and social needs, really. Here we also have highlighted one aspect, which is capacity. Now, capacity is, first of all, you being able to assess if your patient does have capacity. So up in Scotland, we have something called the AWI, which is a form that you would complete if you deem a patient does not have capacity. And this is after looking at if they're able to understand information, retain information, able to process the information to make a sound judgment, and also to express their decision. And all of these are the pillars on which you would assess capacity. So these are some of the aspects that you would need to demonstrate in this section for you to be CREST competent in professional behaviour and trust. So moving on, we have the next part, which is communication, team working and leadership. Again, this will be completed by both of you. And this is very much on you being able to communicate well with both patients, families or carers, colleagues, and also not just verbal communication, but also written communication. So that can include documenting notes on things like ward round and discussions you've had with both patient, family and colleagues pertaining to their clinical management. It could be advice given by visiting clinicians. It's a whole mixture of communication and team working skills that you would have to demonstrate here. And again, this will be completed by both yourselves. Now, continuing on with the clinical care aspect. So this is very much your clinical skills and clinical care demonstration that you would show from a day-to-day basis while you're at work. This is you being able to, everything from you being able to recognize an unwell patient and assess an unwell patient, what actions you've acted on for immediate management, where you've appropriately escalated, how you've dealt with different types of patients, including vulnerable patients, including not just their medical needs, but maybe their nutritional needs, their social needs, their emotional needs, any psychological therapy that you would deem pertinent for them. It's also being able to take a good history, doing a very thorough clinical physical examination, and also, if appropriate, a mental state examination, coming up with the different differential diagnoses that you would come up with. And as part of that, you would also look at various investigations and interpreting investigations, prescribing, of course, and as with any admission, you'd also have to think about discharge and discharge planning and how you've started that off. Now, of course, as new graduates and junior doctors, there is a lot of involvement in prescribing, and with that comes your competencies of prescribing, you being able to prescribe according to guidance. This could be your local trust guidance and also more nationwide guidance, including the BNF. Also reviewing prescriptions, making sure there's safe prescribing, that's making sure all allergies are documented, and ensuring that all medications comply with allergies. So for example, if someone has a penicillin allergy, any antibiotic of choice should of course not be penicillin based, and that's very much important and can be life-threatening if disregarded. Now, of course, with medical management also comes in appropriate decisions and management for the patient in mind. So if, for example, a patient's level of frailty and their prognosis is poor, implementing things like DNR, which is a do not resuscitate form, appropriately after discussing with patient, if appropriate, of course, if the patient has capacity, otherwise with their next of kin who have what we call power of attorney, then that should also be looked at, and also knowing what the escalation plan is. So should a patient be for full escalation from ward level care to secondary or even tertiary care, i.e. critical care, or if they are only for ward level care management is also very important. And as with managing the medical needs of patients, we also come across patients who may be at their end of life care period. And so identifying such patients appropriately, discussing in a just manner, but also an appropriate manner about their wishes of and their goals during the admission would very much often lead to end of life care discussions and the appropriate medications to give them comfort care. And of course, the identifying and certifying of a death in the case if a patient does pass away. And this will also include identifying any hazards and safety issues during their demise. And these are all factors that will need to be looked at whilst completing the CREST form. And next we go on to safety and quality. So this is essentially something that develops your own skills and is it's a good opportunity for training and learning as well, where you're able to identify your job role and also your limitations and escalate at the correct opportunities, ensuring patient safety, so identifying risks and things like falls reviews if a patient was to have an adverse event such as a fall, and also identifying errors and first of all correcting and ensuring that patient safety is maintained, and also highlighting and ensuring that these errors will not occur again. And this part is all to do with that and how you're able to demonstrate it. Now, moving on to the declaration. So this is towards the end of the form where you both have gone through and looked at how you have demonstrated the different competencies for CREST completion. And once both parties are happy and are ensured that the CREST competencies are attained, this is where in the top half of the box, you would complete your own personal details, and the other half, sorry, the top half of the box will be completed by your consultant, who will be clarifying and identifying that they have either witnessed themselves the competencies demonstrated or have sufficient evidence to co-sign that they are satisfied you've completed those competencies. I'll explain a bit about that in a second. and the bottom half will be completed by yourself. And again, this will be where you've completed your personal details. And very importantly, at the bottom, you will need to have either the hospital stamp, or if in the case that there is no stamp available, then a piece of headed paper attached with the hospital logo and details. And lastly, this is just to expand on providing further evidence. So most of you will not, well, I can't assume, but a lot of you will be completing rotations within their jobs. So this could be 4-month rotations, 6-month rotations, or a varied length within different specialties. And you may come across and demonstrate different competencies in these different specialties. At this point, you would be gathering evidence through your portfolio, whether that be an e-portfolio such as HORAS or TURAS, or a paper portfolio in which you will get senior medical staff, either CT5 and above, for a registrar or a consultant to give evidence that you've demonstrated these competencies. And this is where their details will be added in, where you're completing the consultant completing your CREST form has not witnessed the competency themselves, but are satisfied that their colleagues have witnessed it and give evidence. And they will, or they may be contacted. So it is, of course, courteous to let your senior medical staff that have participated and provided evidence that they may be contacted in the process of CREST completion and specialty training application. Now, all of this sounds quite complicated, and I've spoken a lot about different aspects of the CREST form, and it may seem overwhelming, and it was overwhelming when I first looked at the form. Don't get me wrong, it's by no means something that's straightforward or easy to complete, and I'll be honest, I have not completed it fully yet. I am in the process of completing it, but small nuggets of information, both advice from senior colleagues of mine who have completed their CREST form, and skills that I've picked up while completing the form include the following. So as you've seen, the form is quite a lengthy one, and so you will not be demonstrating all these skills in one go at any given time. I would say maybe not even in a single rotation or a single specialty. So as and when you complete the different skills and competencies, do make sure you document it and have senior members of staff sign off on it who've witnessed it on your portfolio, and that will put you in good stead when you do come to completing the form, and you don't have to go back and look for fellow colleagues from previous rotations who may or may not remember witnessing you demonstrating those competencies. So as in when you complete them, for example, things like I've personally found that my NG insertion sign off was during a night shift, and therefore finding the night registrar weeks to months down the line would have been a complicated issue with me. So like that, as and when you complete skills and competencies, it's best for you to get it signed off. And also make sure you are working in the job for more than 3 months before you ask for a consultant to sign off on the CREST form, because that particular consultant needs to have seen you work 3 months or more. And so even though you may have plans to have the CREST form signed off in an upcoming rotation that you're going to be in for 3 months or more, maybe asking them to sign off at the beginning of the rotation might be a bit premature, although a balance would be to indicate to them that this is something you're working towards, and that if they can spare time towards the end of the rotation or when the 3-month mark is reached, so they're aware of it and they're able to either inform you that they're able to give you that time to sign off, or you may need to find an alternative consultant. And that brings me nicely on to point 3, which is the form is lengthy. You would need to discuss about each and every line and each and every sign off, including showing proof of completing that particular skill. And so you would need plenty of time. This is not a form that can be signed off on the run or with a few minutes to spare. My strong suggestion is to, first of all, choose a consultant who, is familiar with you and understands that you would need the CREST form signed off. If they are not aware of what a CREST form is, explain a little bit about it and how much time is involved in completing the CREST form, and that way they will be able to give you appropriate time and maybe make an appointment for a designated day and time to complete it. And often you would find a lot of senior staff are willing to go that beyond, to support you, but they also are strapped for time, and giving them that opportunity to find a time best for you means that they're a lot more receptive to sit down and go through it. Now, along with that, I would say the CREST form is very regimented, and you're able to pick out and identify within your own portfolio which aspects of it can be given as evidence for different parts of the CREST form. And so I would say, whether the portfolio you've completed is online or paper, to tally up and pair up the different evidence you have with the evidence you need to complete the CREST form, and having them in the order you would need it will also streamline and make the whole process a lot easier and quicker for the consultant in question. And of course, you would first of all need to inform the other consultants or registrars who you're putting down details for, that their details will be added to your CREST form completion. That is just a simple courtesy, but also 9 times out of 10 you may not know all the details needed to fill in that last section. So if I go back, you can see that not only do you need their name and their professional status, but you'd also need their work address and email address, and of course the time period in which they supervised you. So all of these details may not be at hand unless you've contacted them and they're able to provide all those details, and that will make your CREST form completion that much smoother. Now, these are only a few nuggets of wisdom that I've gained, and by far I'm not an expert, so I'm pretty sure I have missed things that may be more informative. So I apologize if it's not as extensive as you had hoped, but we're all in a learning process, and this is what I've attained so far, and I hope that it's been useful. Now, we've spoken a lot about completing the CREST form, but not necessarily about why, why are we completing this, or what do we do with this completed CREST form. So this is where I can let you know, pretty much the CREST form is your stepping stone to applying for the specialty training program of your choice, whether that be a GP training, internal medicine training, IMT training, CT training, which is core training in the various specialties, ACCS, which is for acute care STEM pathway, that's including emergency medicine, ICU or intensive care, anesthesia and acute medicine, psychiatry training, radiology training, or obs and gynae training, just to name a few that came to my mind. But all of these different training programs and applying for these training programs can only be started once a CREST form is completed. So this is very much an important piece of document that is needed to be completed, and it does take time and investment to complete it. So please be ready for the long haul to complete it. Now, once you have the CREST form, you do not need to apply for the training program straight away if you're not ready. And the CREST form, fortunately, can be used for multiple applications. So if you're not sure, or you have 2 training pathways in mind for you to apply, then you are more than welcome to apply with the same CREST form for both applications or more. And it can also be used in multiple years and is valid for 3 years from the date of completion. So if you have a training position in mind, or a training opportunity in mind that you would like to apply for, then by no means do you need to wait for, and take time to complete the CREST form. You can complete it as early as possible, with the caveat that you need to have worked in the same job and under the same clinical supervisor for 3 months minimum, but you can complete it in a short span of time. Now, if you are not sure of what training program you would like to enter into, again, if you find an opportunity to complete the CREST form under a specific rotation, then you're more than welcome to complete it. Or if you would like to complete it closer to your application of training program, again, that's also fine, but bearing in mind, you are able to use the same CREST form for 3 years. So you do have that leeway. Okay, and that brings me nicely to the end of the session. Apologies if I took a bit too long, and thank you so much for listening. I'm sure I've, missed things that you haven't been answered, questions that you have burning in the top of your mind. So we're more than welcome to answer your questions.
Thank you so much for that presentation, Kaj.
Yeah,
I really, really appreciate it. It was really informative. So especially for me, being in my final year, so that was nice to kind of get all that information. So okay, right, guys, if you type in your questions and answers into the forum, and then what I will do is I will ask Kaj the questions, and then she will answer them. Okay, so Kaj, we have one question. Where did you graduate from?
Okay, great. So I graduated from Gregor T. Popper in Iași, Romania. So that's the University of Medicine and Pharmacy based in the town of Iași in Romania in 2020. Just
so 2020. Okay,
yeah,
long
yeah,
ago.
yeah.
But at the peak of COVID, though.
Yes. So
It
was an interesting graduation process, but
yeah,
we've all been through our own stories through the peak of COVID. So
definitely.
Yeah.
I lost my fun years. I lost like 4th and 5th year. That was so heartbroken, because like 4th year is like your fun year,
Yeah.
But it is what it is, and that's why I haven't seen you as well. Then I think probably
I know.
2019 maybe, or
that's right.
Yeah, I think so.
I believe there's another question coming up. How long did it take you to start working in the NHS? How was that process? Okay, so I'll try and keep this question brief, but it is a long question. So I believe I got my GMC registration around Christmas of 2020, and my first NHS job was in February of 2021, and I chose to initially locum in psychiatry as a way, in community psychiatry, as a way for me to explore the NHS and the protocols and the system in a setting that was very much supported by my consultant and my team. But I quickly moved on to my current job, which is in Aberdeen, and that I started in August 2021. And I went through a recruitment process for clinical fellows. Right, another question is, did you need to resit any exams during your 6-year course? I'll be honest, I believe I've resat 2 modules within the 6 years of medical school. One was one of my anatomy modules. I've always struggled with all these Latin names, and the level of information was slightly overwhelming, and I think I wasn't in the best peak of my health during that particular exam, but again, that's not an excuse. It was just what it was. So I did read it. And microbiology, it's always a sticking point. I always find microbiology.
I know. I understand, because now I had microbio. I didn't even go to the exam the first time, and I was so scared.
Oh.
I was so scared and stressed out for that exam, and I was like, you know what? I think I'll just give it a miss, and then do it in the resit sessions.
That's right.
Yeah.
A question following on from that is, they didn't make you take the whole semester if you failed? No, fortunately, the medical school I studied at had you had a certain number of credits that you were able to carry on, and also to the following year. But fortunately, I did resit and pass within the same academic year. So that did not apply to me. I passed in the first resit following the exams. Yeah.
Perfect. Right. So, Kaj, thank you so much for joining. I really, really appreciate it. I know you're doing nights, and you can tell. Thank you so much for the presentation. It was really, really informative, and hopefully when you're not doing nights, maybe I could book you for another webinar sometime on a different topic.
I really enjoyed the session.
Just to see.
I hope it's useful for everyone.
Definitely. All right. Thank you so much, Kaj, and I will catch up with you very soon.
Yeah, and thank you, everyone. Yes.
Perfect. And I will share my screen now. Right, guys, I will take over now just to kind of finish up. And what I'm going to do is, like I mentioned before, scholarship prize draw, guys. So every webinar, we do a scholarship prize draw. SME offers a grand total of 45 scholarships to 2022 applicants through the extension of the SME sponsorship program. For all those who missed out on the limited time SME sponsorship program in November 2021, now is a chance to become one of our lucky winners. From January to September 2022, we will be providing 5 scholarships each month to prospective students applying through SME. These scholarships are valued for 50% of the tuition fees for the entire duration of the undergraduate or graduate medicine or dentistry course. A lucky draw will take place each month, so we've got one today as well. And that's why, guys, if you are looking to apply as soon as you can. So I'm just going to do, I've got everyone's names. I got sent them from SME. So what I'm going to do now is I'm just going to pop them in. So I've got all the names in here, guys, and then numbers of names to pick. So 5, and let's go. Right, okay. These are the names that I have gotten. So Miss me, what am I doing? Copy, and these people will get an email from SME regarding the scholarships and just to explain everything. So everything will be in the email, guys, but to all the lucky winners, congratulations. Let's go up here. All righty, let's play that again. So congratulations, guys. Moving on. Right. So just want to give a big thank you to our sponsors, Lecturio, an all-in-one study resource for medical students that combines learning science and medical education into one easy-to-use platform. You can access a variety of high-yield medical videos, lectures, take a closer look at a human body with scientifically accurate 3D anatomy models, really helpful for your anatomy exams and things like that. Test your knowledge and assess your learning progress by answering interactive quiz questions. Prepare for exams using the most advanced question bank available. Even better, all the Lecturio's exam-style clinical case questions include text and video answer explanations. So www.lecturio.com. Thank you, guys. Okay, so guys, here is our feedback form. If you, there's a form here and obviously the captcha. So if you just go on the captcha and fill out the form, we'll send you all of your attendance certificates via email. So that's why I need you to fill the form out so I can send you your attendance certificates. And also one of you guys, one lucky winner that I will pick just randomly through the feedback forms will get, I think, a 6-month membership with Lecturio, completely free. So that's why, please guys, do fill out the feedback form with your correct details. I can send you your certificates and I can also pick one of you guys for your Lecturio monthly membership. I just want to say a big thank you for joining us today. Next month's webinar might be a little bit later, so it won't be in August because we have our webinars on open day webinars, virtual open days. So I think it will be like the first week of September. And then we'll have one at the end of September. So that's just the timelines for the next ones. Thank you for joining in. If there are any questions or anything, please do send them through. And I will see you very soon with a new topic. And if there are any topics or that you guys would like to see webinars on or anything, do pop that through and I will take a look. And yeah, we'll go from there. So thank you so much, guys, for joining. And I'll see you soon. Take care. Bye-bye.